hard, ma'am. It's hard.
A family searching for answers after a 26-year-old mother died following a popular cosmetic procedure.
As NBC6 investigator Miriam Masihi learned, Janisha Williams never woke up from the anesthesia. Now the state is taking action against the surgery center and the doctor in charge.
Janisha Williams was a photographer, a wife, mother to 2 young children, and her sister's best friend.
She was very caring and always knew what to say.
On October 20th of last year, the 26-year-old, known to most people as Jayla, traveled from Hillsborough County, Florida to Best You Now Cosmetic Surgery Center in Plantation for a breast augmentation and a Brazilian butt lift, or BBL. Her mother flew from California to be by her side.
I was asking every hour, how's my daughter doing? How things going? And they kept telling me, she's okay. Everything is fine.
But Latasha says she started worrying when all the other patients were discharged and Jayla wouldn't come out. Then she heard a siren.
The ambulance pulled up. That's when I said, excuse me, can somebody tell me what's going on?
According to the medical examiner, at around 8 p.m., the procedure was completed, but Jayla never awoke from the anesthesia. Latasha says the doctor and nurses approached her as her daughter was being transported next door to Plantation General Hospital.
They politely grabbed me and said, your daughter is dead.
While the medical examiner's report lists the cause of death as undetermined, the health department has filed administrative complaints against the surgery center licensed as Serenity Capital Investments, LLC, the Best You Now, and Dr. John Edward Nees, the designated physician for the surgery center, claiming they allowed a doctor who was not a qualified anesthesia provider to sedate Jayla.
In Medicare regulations, physicians are allowed to give anesthesia, but in practice, that does not happen.
And in Florida, the standard of care rules require surgeons use a qualified anesthesia provider, like an anesthesiologist or a certified registered nurse anesthetist, to administer anesthesia. In Jayla's case, Dr. Millicent Muir, an OBGYN who is restricted from practicing that specialty for an unrelated complaint, administered the anesthesia. While the center has several anesthesia providers on record, she is not one of them. Instead, she is listed as recovery personnel. But according to the state's complaint, she was employed to provide anesthesia for patients. The day we went to the Best You Now, Dr. Muir was locking up the place and said she didn't want to go on camera, but told me she had taken some courses in anesthesiology.
Anesthesiology is a recognized medical specialty.
Though he can't speak on Jayla's case, the president of the American Society of Anesthesiologists says the training is rigorous.
To become an anesthesiologist, you would do 4 years of undergraduate school, then you would do 4 years of medical school like all other specialists. And then after the 4 years of medical school, there is another 4-year period of residency training.
In their complaint, the Department of Health is asking the center's registration be suspended or revoked and that Dr. Nees also be penalized. Jayla's family says nobody from the center has reached out to them as they mourn her loss and try to console her 5- and 2-year-old children.
It's hard, ma'am. It's hard. They ask, can they go to heaven to see their mom? They don't understand.
Neither the owners of the surgery center nor Dr. Nees returned our request for comment. Dr. Muir told us she would grant us an interview later, but gave us the wrong number. Miriam Masihi, NBC6 News.